Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In continuation with the Module 2 Patient Safety, Regulation, Accreditation, Measures and Standard Treatment Guidelines, we will be studying about the Chapter 15 on Quality Management System in Healthcare, where the contents are displayed over here, that is impact of accreditation on hospital safety, risk management, limitations on QMS and strategies to improve quality of care and patient safety through QMS. So, how accreditation improves patient safety? In the previous chapters, we have studied about what accreditation is and how accreditation helps the licensing procedure, how it comes up actually to meet up for the certification part. Now, we will find how it improves patient safety. Creating a formal quality system. So, most large hospitals already have their own process for checking and improving quality. That is called as quality management in hospitals. So to get accreditation, hospitals must change their current practices to meet the standard of the accrediting group. Another way is to build the accreditation rules directly into the hospital's current quality system. Over time, following these accreditation rules just becomes the normal way the hospital works, and the hospital keeps on continuing actually for these rules. Setting rules and making staff aware. So this is the second line in order. The accreditation process provides basic rules to make sure patients are safe and receive good care. So it is important that all staff are included in this quality plan. Accreditation encourages staff at every level to take responsibility for their specific jobs. Getting ready for accreditation and talking with inspection team creates a focused and energetic feeling among the staff. The staff feel empowered. Helping the staff start strong with a focus on quality is the purpose of the team over there. Third comes in line making work standard, that is standardizing processes. So what it is? The accreditation group requires that all hospital work must have been written in rules and steps, policies, procedures and protocols. This written information must be easy for staff and to find and read it. Inspection compare the actual work being done with the documented rules. If we don't have the documented rules, it is very impossible actually for the hospital team to work on it. This makes all hospital work the same time. Means like it is standardized across, keeps everything consistent and reduces mistakes by the staff. It also gives new staff clear directions on what they need to do. Next comes keeping the quality system strong. Why it is so emphasized that the quality system needs to be strong? Once a hospital is accredited, it must continue to meet the quality standards, to pass ongoing checks and re-accreditation. Reporting is a key requirement to keep accreditation. It helps the hospital track mandatory results and make processes more efficient. Regular self-check helps spot where work is different from the rules, leading to necessary changes and improvements. Improving work through quality management. Always getting better is a main part of quality management. And hospitals find way to improve them. Watching for bad events or errors, collecting standardized information, looking closely to incidents and figuring out the main cause of it. It can be done through the root cause analysis. Also, additionally, getting feedback from the patient and staff is very important to improve the work through this quality management. Now, we'll focus on managing risk. How risk management is done. Risk management is a major focus of the accreditation process. Risk comes at any time, and the risk management process involves the 4 steps. The first one is finding the risk. What is the risk? Where is the risk? And in what way we can deal with the risk. That is called as diagnosis. This means finding dangers or possible problems. Risk can be found by reporting bad events, incidents, and mistakes. inspecting facilities, equipments, and the environment, reviewing feedback from the patients and the staff, giving them something as an input actually they need, checking compliance with legal rules and standards. What are the current rules? What are the updated ones? Why the hospital need? These all needs to be checked with the compliance part. Making sure accreditation rules are followed and everyone abides those rules. Evaluating risk. Evaluation risk is called as assessment. This means figuring out the chance of harm from the risk found. And though what are those risks we need to work on? All information must be checked for possible bad effects on patients, staff, and property, where the hospital has to look for every information availability. Tools like root cause analysis find the main reason for the problem, which gives you the entire end result where is the problem. Also, other processes should be checked for. In this line, predicting the impact. All the work that what you have done, you need to go for the prognosis. Just like the disease identification, we are predicting the impact. This means figuring out how severe the bad effect will be. What will be the consequences of this bad, which is often calculated as a harm score. So, do we need to handle this risk? Yes, it is. The management needs to be prepared to handle this risk. The main goal is to reduce the harm to the patients, staff, and hospital finances. This is done through a process. The process starts with training and teaching all staff about hospital procedures and safety rules. Following rules when hiring the staff. You need to think about the credentialing, you need to work on the privileging actually, where you cannot simply put up hiring in any way. Making sure there are enough staff in all areas. An entire group needs to work on ensuring actually that every area of the hospital has enough staff. Managing patient health records, that is called as EMR, electronic medical records, where the patient needs to get an updated record actually to keep the data safe and private according to the rules of HIPAA. Checking that legal rules are being followed properly. Updating and checking all rules and important papers are needed to be kept when you have to identify the risk. Watching the trends and rate of key medical and management results are utmost important. In next line, it comes on increasing efficiency of the process. Whatever process are you are going through, reducing the cost and ensuring the safety needs to come in line. During the accreditation process, hospital leaders write down and review how the work is done, which is very, very important. This helps make the work simpler and same every time. That is called as streamlining and standardizing at a moment. Checking points and measurement tools, where monitoring indicators are set up for each process, allowing for constant improvement. Getting rid of unneeded steps saves money and make the work faster, which boosts the efficiency. When work is done the same way every time, that is called as standardization, it removes the differences, making it more reliable work and safer for the patients. What is the optimal use of resources that we need to think on? Figuring out healthcare cost and deciding how to use resources like supplies and staff is a big concern. Deciding how many supplies are needed can often be based on opinion. The opinion can be even a subjective. The accreditation process uses facts and is a data based, where we need to emphasize more on collecting the facts and use the data. Deciding how to use the resources relies on objective quality information, such as information can be how long patient's average length of stay is, How much of infections rate is developed, just like infections rate like HIV rates, death mortality. This information helps the hospital use its resources in the best possible way. What are the benefits of this for the employees? Do we find anything for that? So teaching and training staff are key parts of making the accreditation process work well. The hospital system and procedures are often created by the staff themselves. No one else is preparing it. So this makes them feel very responsible for encouraging ownership and increasing their confidence. During the inspection, senior people talk with the staff. They work with the staff, which helps the staff feel very sure of themselves, and it strengthens their teamwork, which helps them to motivate actually for working on this cause. Staff training starts when they are hired and it continues at every level. It is not there that you have to give them a stance or you have to give them an end. It is an entire continuous process. This helps employees understand the processes, rules, and what they must do, leading to better work. Staff also learn soft skills that help them grow overall, which is very important that they need to get upgraded. Doing work in a standardized process and having effective communication ensures openness, which makes the employee happier with their jobs and give them a greater employee satisfaction, which is very important for any employee. Benefits for the patients and the family. Do they really get the benefit from accreditation? Do the family really benefits from this? Yes, it is. When a hospital works towards accreditation or quality tool, it must set up clear ways to teach and talk with the patients and the families of the patient. In a healthcare or a hospital, teaching patients and family is very important. The need for is for their safety and care while they are being treated over there. Patients and family become more involved in their care when they understand the things like the things can be interaction of the drugs, the use of the proper drugs, what are the rights of the patients, what are the risk of the falls and infections, complications and the risk coming out. Giving permission or consent, which is very important with respect to the legal cost of the treatment, which is very utmost when you have to communicate with the patients. What does it really gives? This involves lead to better results, and much more than that, it is the higher happiness or the satisfaction. Communication creates openness, it gives transparency, and what it results to, which helps patient and families to trust the hospital, which is very important facet for any hospital to develop a trust. Quality management concept. Quality management encompasses the actions an organization takes to direct, control, and coordinate quality. These actions necessitate creating a quality policy and then establishing a clear quality objectives. The scope also covers the essential areas of planning for quality, regulating quality, providing quality assurance, and continuous quality improvement. The quality management system isn't just about following rules anymore. It's a full system that helps the entire organization focus on being excellent, safely avoiding risk, and making constant improvement, which is a need for any organization. Are there any limitations for the QMS, the quality management system? Sometimes hospitals find it hard to keep up the effort when after they getting accredited, and it is very important that a hospital needs to continue. This often happens when hospitals look for easy way out and fail to make the standard a true part of their daily work. Here are some important reasons why quality management system might not work well. So is it that there are some things actually that we need to more emphasize on? It is very important to know these reasons. The reasons can be the step taken to improve quality do not match the hospital main goals of giving safer and good care. The hospital might expect more, where versus the established system on quality is not well fit for that. Hospital leaders do not actively deal with possible problems that the quality department points out. Quality department is saying something and the team is working with some other thing, and the hospital employees are not effectively dealing with the challenges that the team has put it up. Hospital has not created a culture where safety, managing risk, and always getting better are important. Where I need to emphasize to see that the hospital needs to create a culture among the employees to see that there is patient safety culture. There is a well established philosophy of quality. The hospital lacks a good way to collect and study information. The information is the data to find out the areas where the risk to be organized is the highest. Often, information is written down manually. Most of the hospital deal with the issue that they are more manually, which creates lot of mistakes and there are limitations for that. So, not all reported bad events are studied. It is not said that people don't learn from the mistakes, but to find the main reason, what is the root cause is very important. You can learn from the mistakes when you do a reasoning to find out the cause, the work actually which is to be seen only through root cause analysis. In many cases, the suggested changes are not put into effect correctly. Even though you know the causes, even though you work on the reasons, but if you are not giving a proper changes, what it impacts to? It will impact in a wrong way. And many of times when even the suggested changes are given, they are not checked later. Whether they are continuing it in a proper way, whether the people are working with the proper process, and whether they are making it the same expected changes which are needed by the team over there. Hospital does not give the needed money or resources. It is for new quality projects. So quality projects needs to be a priority by the hospitals. Accreditation rules are seen as a job of only one department. So like the quality people are working and that's their headache. The entire hospital is taking a rest. Means like to say that they are doing their work but they don't work on quality. They don't care about quality. They don't even think about patient safety. So the entire organization's efforts needs to reflect if they have to take this and not to be seen as a job only of quality management department. So what are the future strategies? Do we need to recommend to improve quality of care and patient safety through quality management? Alignment of strategic goals, risk management and quality management system. To make the quality management system work better, we need to link it with the hospital's main strategic plans and the plans for managing the risk. It is one actually to see that the quality management system is with entirely working in the hospital. When these three areas work together, we can make sure patients are safe and they get more proper or best results. The accreditation rules help achieve this because they focus on patient safety by involving all levels of hospital management. All the information gathered from checking quality will help the hospital meet its main goal. And thereby we find that the main goals of the hospital needs to have quality in it. It should also help in making work processes better and lowering the risk. So is there a business case? Making this is a business case. A business case explains why a hospital decides to spend money and resources on certain effort. The hospital needs to take it as a resource constraint. Quality improvement work must be connected to hospital's business case. It is very important that the hospital needs to see through a revenue point of view because it directly affects patient satisfaction and also lowers the cost by making processes efficient and using resources better. Many times people say that quality needs to pay more money. It is completely opposite. You will get patient satisfaction and lowering cost if you are working on quality. Many people now believe that accreditation provides high quality patient care and better results. It could be only better if you help lower the cost of the healthcare. If you increase the cost, the quality doesn't work on. In summary to this chapter, I would like to focus that accreditation establish a formal quality system in the hospital. It is very important that the hospital needs to emphasize on this part. The hospital needs to require them to meet the specific standards and additionally effectively making quality management a normal way the hospital should work on. It is not that it should take only for one instance, and there needs to have some basic rules to be followed and policies ensuring all staffs are included in the quality plan. Again, I am emphasizing to state that quality is not only by quality cell or quality management department, and it is encouraged that every employee needs to take responsibility for the patient safety. The processes mandates making work standards through written rules, which is very important, and steps, that is policies, procedures and protocols to ensure hospital work is consistent and reduces mistakes. I repeat, the steps are policies, procedures or protocols. Accreditation requires keeping the quality system strong through continuous compliance, regular self-checks and reporting. What does it results to? It results to make processes more efficient for ongoing checks, the current checks which are going on, and re-accreditation, which is a continuous process way. So, accreditation leads to increasing efficiency, reducing the cost by standardizing the processes and removing unneeded steps and making work more reliable and safer. So, it ensures optimal use of resources by relying on the facts and data-based information. It can be much more working on the average length of the stay of a patient. It is to work on the HAIs. It is to work on more on the subjective opinion which is given by the team. How does it really makes the quality management system works better? By having a future strategy for that, rather not only relying that you are working on the current part, but also you have a plan next angle. The alignment of strategic goals, risk management and quality management system. Accreditation rules helps achieve this. It helps actually on focusing on the patient safety, involving all levels of the management people and not only the quality management team. The information gathered helps the hospital meet the main goals that the hospital has set, that a quality management system is their priority. And it aligns actually to make the work processes more better, also lowering the risk at optimal utilization of the process. So with this, we end with this chapter and have been seen with the references which are coming with the role of quality management, which has more on improving patient safety. All your projects or your team which are working on the quality needs to emphasize on all these parameters which are discussed in the chapter. So thank you for today.